Hello, welcome to Senior Citizen Wellbeing Channel podcast. And I am Raj, physical therapist, and here with me today is Ryan. He's also a physical therapist. We both have Doctor of Physical Therapy degrees, and we are going to talk about shoulder joint. Um, what are the causes of shoulder pain? What are the signs and symptoms of shoulder pain? And what are the treatment options without using medication like physical therapy?
The shoulder, as far as bone to bone, is only attached by a collarbone. Just that little
Right.
collarbone you have right
That's right.
there. And then everything else is just muscle that's what allows it
Amazing.
to get
Yeah.
it so much motion. But yeah, but then that collarbone attaches to the shoulder blade, and that's where the shoulder joint is on the shoulder blade. But the shoulder blade doesn't attach to anything else in the body other than the shoulder joint. And then that goes to the collarbone, which comes right to
Collarbone.
here. So
Exactly.
it is pretty complex, but we're going to talk a little bit more about some of the symptoms that we might come across.
Right. Especially the population that we see, senior citizens, most people have shoulder pains, either right or left, based on which sides they sleep. A lot of people complain about pain on the side they sleep. They're not able to, I'm in some of the Facebook groups where they talk about after, especially surgeries, they can't lie on their side. That's a big problem for some of the patients. And, what are, what do you suggest for people that have shoulder pain? What are some best positions? Maybe if you want to talk about that, what is the best position for shoulder pain to rest?
Yeah, a lot of times what we have is kind of a neutral position of the shoulder where the shoulder joint itself, because of all the muscles that go around it, that it's not so compressed into it. And so there's certain positions of the shoulder that really helps that joint to be more in like a loosened position. And a lot of it's just the elbow to the side and kind of the hand right in front of the shoulder, like you're in a sling. That's kind of more of
Exactly,
that
yeah.
loosened
And
position to
using a
help it be
pillow,
comfortable. Yeah.
right? Using a pillow, resting the arm on a pillow is one of the good positions.
Mhm.
Um, okay, so can we talk about some signs and symptoms of the shoulder pain? Um, what do you say
Yeah,
that?
so a lot of times there'll be pain with movement, and there'll be pain sometimes with sleeping on the side. And then sometimes just depending on the location of the pain, and that can kind of almost help with the diagnosis of what's causing that pain. A lot of time with tendonitis, like an overuse, that happens on the front of the shoulder a lot. And then shoulder pain that involves like a rotator cuff typically radiates and they feel it down on the side there. And so a lot of times that can help to determine. It's not a diagnosis by any means, but it kind of helps give us an idea of what is causing that.
Sure. And I think how do, what is the presentation of the shoulder arthritis? Let's say glenohumeral arthritis. Um, what do patients complain most?
Yeah, a lot of times arthritic pain in the shoulder will be really stiff and some soreness first thing in the morning. And once they kind of get it moving a little bit and doing some things, it starts to feel a little bit better. Kind of that motion seemed to help loosen it up. That's typical
Right.
of an arthritic joint pain. And it can just kind of feel stiff and all
Gen
over the whole shoulder right there.
Right, the more generalized pain than
Hmm.
biceps tendinitis, where the pain is more specific to the front and in this shoulder area, front of the shoulder. Whereas the arthritis is generalized pain. It can be inside,
Hmm.
it can be outside. but more if it is deltoid or rotator cuff muscle pain, that's more around the shoulder, and as you said, it radiates kind of down below the deltoid muscle. Great, thank you. Okay, for the treatment of the shoulder pain, I usually prefer rice is the first treatment technique for any pain. If you watched my previous videos, we talked about hip, knee, and ankle joints. And for everything, even including the shoulder pain, I want to go with the rice. Rest, ice, um, compression, and elevation. Those are the four things that will treat most of the minor pains and aches. But if the pain is severe, like after the shoulder replacements, rice is still good, but you have to also take prescribed medication, whatever you get from the doctor. So that is the most effective way to manage your pain in general. Your physical therapist or your doctor will know more specific to your condition. So talk to your doctors. But Ryan and I will just briefly explain what are some treatment options in physical therapy. Ryan, do you want to go ahead and take over and explain
Yeah,
some
we talked
treatment
about
options?
some are like the tendonitis, or some of the pains from overuse and that happen to be kind of right in the front of the shoulder. And what it is a lot of times when we have our hand close in, it rolls in that part of the muscle tendon that's has that overuse. And then when we roll the shoulder out like that, it exposes that bicipital tendon. And then that's
Right.
really, really tender to the touch there. And so like an ice massage right over that area for around 7 minutes is good. And
When you
so,
say ice massage, do you mean placing the ice
yeah,
cube on it?
like
Yeah.
getting a little ice cube, wrap it in some paper towel sometimes, or what's really good, that's used like a styrofoam cup, and you freeze it overnight, and then you can just peel off the cup to expose the ice, and then have a
Sure.
towel, because it's going to melt. And then what I
Right.
go by when I talk to my patients, I say, first you're going to experience the cold, and then you'll experience a burning sensation, and then an
That's right.
aching sensation, and then it gets numb. And then that's about 7 minutes of that. And what's nice
Perfect. Yeah.
though, that approach can kind of help diagnose it too, because if it is a tendonitis, and after you do that and you're like, yeah, that feels a little
Pain
better. I think I
subsides.
kind of hit the spot. So now you know what we're dealing with. And so that's
Right.
a good one to help out with the tendonitis and that. Mhm.
Great. What about if it is arthritic pain? What do
Yeah. And the
you?
arthritic pain, motion is lotion, you know. And so what's
I know you
really
keep
good to do
saying
that,
that.
yeah. And what's really good to do with that is have gentle assisted range of motion that is pain-free, that's what you tolerate. And a helpful one is laying on your back and having like a cane or a broomstick or your other good hand to kind of help, to lift that up, and just nice, gentle, easy, pain-free range of motion. Keep it simple, and then just kind of helping to get that loosened up and get that moving. So that's another treatment that helps with the pain management.
Sure. And also the pulleys is a good way to
Mhm.
use do perform
Yes.
the assisted range of motion. And I will include the um, Amazon affiliate link in the description below
Yep.
for the
Yep.
if somebody wants to
Yeah, that's a go-to place.
purchase it.
I talk to all of my patients that need a pulley. Amazon has
Pulley.
a great site for it. They're
Right. Yeah. They're not
well made
expensive. They're
and it,
$10. Yeah. Yeah. Perfect. And what are some exercises? I know you already mentioned about, we talked about the shoulder range of motion. Are there any other exercises that you can suggest viewers about shoulder pain?
yeah, I
Is
think as far as pain goes, it triggers a response in the body. And so it's going to really start the healing phase. And so when you're doing some of the modalities, you're doing some of the treatments and stuff, and like the motion is the lotion, it's helpful as long as you start with the pain-free, range of motion that you tolerate. But I like to do things as far as let gravity be the first tool to help with the strengthening and not trying to get some of all these other things, because our bodies are made to design to overcome the effects of gravity. And so just the weight of your arm is a good place to start with the strengthening phase.
Right. And also, as you were mentioning gravity, I'm thinking, pendular exercise where you drop your arm next to your, arm on the side and just roll, kind of let it swing, just let it freely move, make circles, go forward, back, and side to side. So that can be a good,
Yeah,
relaxation
yeah.
exercise for the shoulder.
Yeah,
So,
that's just letting it swing like a pendulum, just like
exactly.
gravity. And yeah.
Perfect.
Yep.
Thank you very much, Ryan.
Yeah, so in conclusion, with shoulder injuries and the causes and treatments, just understand with a lot of injuries that does take a biological time clock, for it to heal. So give it some time, be patient with it, and follow the protocols that your doctor has set for you. And if you have a physical therapist, to work with your physical therapist. And also, we'll be continuing to make these videos weekly. And as you enjoy it and have any questions, ask us, and we'll continue to help address your questions. And hopefully these videos are helping you out. Thank you. How about you, Raj?
All right. Yeah, that's it. So thank you very much, Ryan, for your time. And we will come up with more topics and more videos. We'll continue to make more videos. Thank you.
Thank you.